Welcome to the M Show. Welcome to the Children of the 90s Discovery Day. I mean, what a fantastic opportunity and a brilliant turnout. It's amazing to see you all. Thank you. You guys are the boss. You run the show. This is your study and you contribute and make it happen. We cannot operate without you. You've generated a community resource is the way we think about it. It's really very spectacular. It is unique internationally. There are literally hundreds of thousands of data points collected on you. You are the most deeply characterized pregnancy cohort in the world. And I can say that with absolute confidence. And that is why we have 1,000 researchers coming to use the resources that you generate in aggregate. That is why 220 or so papers in the academic press go out a year, 3,000 or so in total. That is why we get 20 applications for the data and the samples a month. The team are sprinting just to keep up with the demand in order to be able to use your data that you've kindly donated, which then enables research both nationally and internationally. It's extraordinary. We can barely keep up with it. But it's exactly where we want to be, because Children of the 90s is cutting edge, and that's the job. That's why we're all here. We share that passion about sharing and about making better science to enable policy, healthcare, well-being. And consider some of the examples that you've been involved in. The flexibility in and around the pandemic, for one. The research that we had based on existing mental health data, for example, running over the years leading up to the pandemic. Then, and only because of that, allowed us to examine the impact of lockdown and mitigation on the mental health of individuals in Children of the 90s across different age ranges, and to understand better the pressures and strains that was exerting on everybody. Those information, those data, and the policy, and the, if you like, the interpretation of those data went straight to SAGE, went straight to Cabinet. And that's extraordinary, right? So on the ground data that you've done, questionnaires and contributions to the study over the years, coupled with your contributions and your ability to react during the pandemic, generates data. Research comes from that, and we can push that out to policymakers and change things, which is fantastic. I mean, that's it. That is the cutting edge of what we're supposed to be doing. And in my world, the academic world, that doesn't happen. You know, I waited a whole career for a single contribution to policy or a single contribution to something real and translated, whereas we can count the examples that you guys have been involved in: mental health, liver health, online content. So a brief update then, what's going on and where are we? You all know about the questionnaires and the At30 clinic that's happening right now. We're casting our eye to the next 5 to 10 years. And what's going to happen in that period? Well, we're not going to do another giant sweep immediately after having done one at 30 years of the study, but we're going to be concentrating on life events. What is it about reproductive history that we need to understand better to be able to understand the stresses, strains, and biology of family life, having a child, and those relationships? How do we keep people up to date with and also engaged with us over the next 5 years when we want to send out more questionnaires about lifestyle, about financial constraints, about social pressures, and how that might then have a long-term effect on our health and disease? And actually, if you think about where we are with our participants, our original children, they're moving into that phase now where if we ever want to do something about prevention, we've got to study now. It's all very well doing studies of cases and controls, which is a design often used in epidemiological research. But those are cases of disease that's already there, and we're trying to repair and rescue, not prevent. If we want to really get in the business of prevention, we need to understand the life and keep moving forward before those events happen. That's going to be the focus. That's what we're really interested in. And what do we want to do in a slightly different way this time? We want to do that in an integrated way. We want to integrate more with local service providers, more with local policymakers, more with the region, and think about how we can contribute. Outside of that, of course, we want to contribute to national initiatives, bringing together the different studies. We work with colleagues in Bradford and Scotland and Liverpool doing similar things. And we need to share data together to do better research in different demographic circumstances, different stresses and strains. And then, of course, internationally. And the one thing, actually, bizarrely, from Children of the 90s point of view, you've always contributed in that frame because nobody's got data like your data. Those things don't exist elsewhere. And you may think, if I'm just spoken about pregnancies and families and that sort of thing, you may think we've done this already. We did this with the original pregnancies, did we not? Well, yes, but in part. We did that with no backdrop. The original mums who engaged with us right at the beginning, and partners and families who carried on, did this, but there was no prequel to that story. We're now doing this at age 30 years of Children of the 90s. That gives us an amazing opportunity to track that life experience into the examination of health and disease going forward. So I encourage you all to keep involved. And we're trying to be all ears. We're trying to listen to all of you, and we've been learning about what sort of things that you'd like to research. It's great to hear that health inequalities are areas that you want us to look into. Musculoskeletal health, dental care, nutrition, these areas that we've dipped into and we have worked in, but we want to hear from you about your energy, about explicitly targeting them. So it's really important that you understand that you shape the study and you have opportunities to shape the study. We're here as custodians to look after it, ensure safety and governance, and do it properly, openly, and facilitate research. But you're part of this and you drive it. So let's keep it going. Let's not drop the ball now. Let's really make it second to none and keep going over the next 10, 20 years, whatever it takes to make it contributory, to deliver policy and to make a difference. So stick with us. Please stick with us. I know you guys do. Preaching to the converted, you're in the room, that's mega. But do spread the word. If you know folks who are involved in the study, who have been part of it in the past, who couldn't make it today, tell them about it. Keep spreading the word.